Module 2, Reframing Headache and Migraine, the contemporary research. Reframing headache and migraine challenges the medical model, the classification system. Whilst a diagnosis may be important for research purposes, Module 2 proposes that a diagnosis is not important in the clinical setting. After all, a primary headache diagnosis is based on a set of often shared between the different primary headache forms, unvalidated signs and symptoms, not on pathophysiology. A diagnosis is just a label and an opinion. This module discusses contemporary research which supports the various forms of primary headache sharing a common pathophysiology, a sensitised trigemino-cervical complex. The pivotal question that needs to be answered is, what is sensitising the trigemino-cervical complex? Furthermore, despite research surrounding centrally driven central sensitisation being equivocal, there is an assumption that this is the case. This module challenges this assumption and submits justification for peripherally driven, peripherally C1, C3 afferents driving central sensitisation in primary headache. Finally, whilst reproduction of head pain is recognised as a key diagnostic criterion, it does not confirm cervical relevancy. The case for reproduction and resolution of typical head pain as the technique is sustained will be proposed as the most powerful clinical tool confirming cervical relevancy in primary headache conditions. So the aims of Module 2, I'm going to challenge the medical model. I will be presenting contemporary pathophysiology of migraine, and this can be extrapolated to primary headache because migraine is a phenotype of primary headache. Challenge the assumption that centrally driven central sensitisation is responsible for primary headache, and also challenge reproduction of head pain as a key diagnostic criterion of cervical relevancy in headache and migraine. Together, Modules 1 and 2, with sophisticated videos and animations explaining the trigemino-cervical complex, sensitisation of the trigemino-cervical complex, and the previously unrecognised pattern of musculoskeletal misbehaviour leading to alternating headache, challenge traditionally held beliefs and teaching. Modules 1 and 2 will change your paradigm around cervicogenic headache and the role of cervical afferents in primary headache.